Artificial intelligence is finding its place in all sorts of scientific fields, and perhaps none holds more life-saving promise than healthcare.
Artificial intelligence has a place in the field of medicine. Like it or not, it's already being used in a lot of ways, like detecting rare genetic disorders, helping ALS patients speak, and even diagnosing some potentially deadly diseases.
A longer living population, the introduction of transformational healthcare technology, and ongoing global economic turmoil. These are the primary socioeconomic drivers that will influence healthcare in 2024. With these in mind, here's our take on the most significant AI breakthroughs in healthcare in 2024. 20. Behavioral therapy. Mental health issues are becoming increasingly widespread in modern society. However, resolving them takes time and can be costly. Unique mental health challenges, such as the opioid usage crisis, necessitate the development of novel approaches to providing effective patient care. Fortunately, AI-based cognitive behavioral therapy can help. This developing approach detects depression, eating problems, and substance misuse, and assists in providing appropriate therapies through personalized medical services. 19. Stroke detection. Every minute counts when someone is suffering from a stroke. Accessing professional stroke care takes a long period, which may have an impact on the patient's long-term health. Aside from that, medical specialists continue to struggle with determining the precise location of the collapse. Automation and artificial intelligence techniques can help medical workers detect and cure strokes. Doctors can use automatic stroke detection equipment to patch gaps in high-quality imaging investigations that identify the type of stroke and the location of the clot or bleeding. 18. Digital twins. A digital twin is a virtual representation of a physical system, object, location, instrument, or process. It can be used to imitate anything from a single instrument, such as a needle, to a whole hospital in order to better understand how services are delivered. Digital twins of the human body and particular organs have been created to simulate the consequences of therapy, medicine, and lifestyle changes. Perhaps the most intricate digital twin currently feasible is a human brain twin, which researchers expect to have developed by 2024. 17. Suicide prevention. A 2016 survey found that over 45,000 people died by suicide in the United States. The primary cause of suicidal and self-harming ideas is socioeconomic and mental health issues. However, social media monitoring of profiles can assist identify such suicidal ideas in advance. Artificial intelligence can analyze social media and health data to detect self-harming behaviors. Following that, patients can use AI-powered apps to continue therapy and support until they recover. 16. 3D printing. In addition to artificial intelligence, robotic capabilities are gaining traction in medicine. Existing robotic limbs and legs can already function as human body parts. 3D printed hands are an advanced approach that will further expand the capabilities. Simple chores, such altering the television's volume, can be completed from a distance by simply moving the 3D printed limbs. It also includes speech recognition technology that can control smart home functions. 15. Virtual hospitals. This movement encompasses telemedicine and wearable gadgets linked to the global network, the Internet of Things, IoT. More care can be offered remotely by utilizing linked devices to monitor patients and provide communication channels for healthcare professionals remotely. We refer to this as telemedicine 2.0 since it goes beyond the simple delivery of remote care, such as remote consultations, and instead takes a comprehensive approach to remote patient care and treatment. Virtual hospital wards are one example of this trend in operation in 2024, with a single site serving as a center for monitoring several patients in their own homes. 14. Autism. Despite the fact that we know autistic children face a variety of challenges daily, we frequently fail to take action to aid them. Autism virtual reality encourages empathy and allows those who care for autistic patients to support them better. Wearing this VR headset allows individuals to experience what it's like to have autism. This could assist to shift their perspective on autistic youngsters. 13. Cancer detection. The ability to detect cancer at an early stage is unique. However, as technology advances, it becomes more feasible. Artificial intelligence can detect anomalies in radiographs at early stages. This aids in detecting any confused or unusual motions in the body that may indicate cancer signs. Artificial intelligence is widely employed in cancer detection, screening, treatment, and chemotherapy. 12. Preventative healthcare. This covers a variety of themes. including fitness, wellness, and vaccines. But it all comes down to the adage that prevention is preferable to treatment. This transition from reactive to proactive techniques will be a strategic goal for healthcare providers in 2024. Research has demonstrated that it can provide long-term benefits to patients while lowering the costs of treating preventable illnesses. Technological advancements like artificial intelligence and wearable technologies will also play an important role in enabling early detection and speedy intervention. 11. Microscopes. These microscopes are used to detect dangerous germs in blood samples. They can work faster and more accurately than human lab technicians. Beth Israel Deaconess Medical Center has developed a diagnostic microscope that utilizes artificial intelligence to detect dangerous diseases before humans do. It detects dangerous germs in blood with 95% accuracy. 10. Digital nurses. During the COVID-19 health tragedy, we learned the value of medical institutions worldwide. Along with that, we found there isn't enough medical staff, including physicians and nurses, to handle the influx of people. Fortunately, digital nurses are here to help change patient care. They can assist keep track of patients' conditions in between medical visits. For example, Molly is a digital nurse developed by Sense.ly to monitor patient conditions. 9. Personalized medical care. Giving similar treatment to 100 patients who suffer from the same disease is not a good move. Everybody's body type, immunity, medical aspects, etc. might differ. Therefore, healthcare institutions are developing personalized treatment facilities that could leverage tailored patient care by carefully analyzing their health data. This will reduce the cost of extensive healthcare and increase effectiveness. Healthcare institutions use machine learning technology to match patient data with the most possible effective medications. 8. Surgical robots. Surgical robots are transforming operating rooms by combining artificial intelligence capabilities with collaborative robotic activities. Although today's robots may perform surgical procedures autonomously, clinicians remain there to supervise the surgeries. They can, however, perform simple tasks and repetitive movements without the doctor's supervision. Incorporating AI capabilities into surgical robots can enhance control accuracy to sub-millimeter levels. 7. Elderly care. Many affluent countries have aging populations, which will eventually place more strain on healthcare systems as people live longer and demand more help in their later years. Innovative solutions that allow the elderly to stay in their own homes for longer periods of time, rather than occupying space in hospitals, hospices, and nursing homes will emerge. There will also be a greater emphasis on creating novel treatments for diseases that occur only in old age, and place a load on healthcare systems such as Alzheimer's and Parkinson's. Other trends covered here, such as preventative care, virtual hospitals, and healthcare assistance, will have significant effects. 6. Mental and physical healthcare. For most of medical history, mental and physical health treatment have been relatively separate. The COVID-19 pandemic has changed this, as doctors acknowledge the inextricable linkages between physical and mental health, and the importance of a comprehensive strategy. In 2024, frontline healthcare providers, such as primary care physicians, will increasingly test for ways in which mental health concerns may affect the treatment and recovery of physical ailments. 5. Neurological diseases. This technology is turning MRI and CT scans into a high-stakes game of Where's Waldo? But instead of looking for a guy in a striped sweater, it's hunting for the earliest signs of conditions like Alzheimer's and Parkinson's. With AI, these once elusive diagnostics become as clear as day, offering a chance for early intervention. It's like having a superpower that sees through the brain's complexities, finding the needle in the neurological haystack. 4. Faster diagnosis. This is where AI becomes the Sherlock Holmes of the lab, scrutinizing slides that even the most eagle-eyed pathologists might find challenging. Identifying patterns and markers at superhuman speeds is turning the tide in the battle against diseases, ensuring treatments start sooner rather than later. It's not just about seeing the small stuff, it's about seeing it faster and more accurately than ever before. 3. Automated data analysis. This is not just data crunching. It's like having a digital detective on the case, sifting through mountains of health records, lab results, and patient histories to unearth clues about diseases and treatments. It transforms raw data into a goldmine of insights, making healthcare more proactive than reactive. It's like watching a master chess player at work, except the game board and every move is calculated with precision. 2. Natural language processing. We then jump into the tangled world of clinical documentation, untangled by the superhero of the hour, natural language processing, NLP. This tech isn't just about understanding human speech. It's about giving doctors and nurses their time back. Don't imagine. Just acknowledge that paperwork can now be done quicker than a coffee run, thanks to AI that listens, understands, and documents. 1. Generative AI. As seen, AI will play a role in many of the themes we've discussed here. But generative AI, in particular, will have a significant impact. It opens up access to additional disruptive AI applications, making it easier to implement, interpret, and provide personalized suggestions. It can generate synthetic data that can be utilized to train medical AI algorithms without jeopardizing patient privacy, or in situations when there is insufficient relevant real-world data. It can also construct chatbots and virtual assistants to support patients at all stages of their journey. The applications of generative AI in healthcare are virtually unlimited. If you have made it this far into the video, then consider commenting, liking, and subscribing if you haven't done so. And check out this video for more AI breakdown.